Students, welcome to the module 3 of the subject Applications of Computer in Pharmacy. So, this is unit 3, and this particular chapter, whose title is Applications of Computer in Pharmacy, we shall be studying the following content. First, we shall talk about the drug information storage and retrieval, followed by pharmacokinetics, drug design, mathematical modeling in drug design. Under computational approaches, we have to study about the hospital and clinical pharmacy, the electronic prescribing and discharge system, the barcode medicine identification system, the automated dispensing of the drugs, the mobile technology, adherence monitoring, the diagnostic system, followed by patient monitoring system, and the importance of all such functions in pharmacy. So before moving in detail, so if we try to find the application of computers in pharmacokinetics, first you should understand the meaning of the term pharmacokinetics. Being the second semester student, you must first understand its meaning. It is actually a science which deals with the rate of absorption, metabolism, distribution, and elimination of drug, and it is commonly abbreviated as ADME. So, the pharmacokinetic analysis, basically what we actually deal it with, we actually determine the basic information of the drug once it goes inside the body or is administered in the body. So the parameters or the information that we usually determine are the renal clearance, the volume of distribution, the metabolic disposition, the absorption, and multiple dosing of the drug. So this pharmacokinetic analysis, it involves the non-linear least square regression analysis. What is actually involved in this particular analysis? Generally, we fit the experimental data to a set of differential equations and select the parameters with acceptable goodness of fit. So in 1969, Metzler introduced the first package which was called non-lin, which fit the non-linear data to a predetermined pharmacokinetic model, and he utilized this least square regression analysis. Other than this, there is another program called multi, and this program actually allows the users to define at least 5 functions simultaneously, which may simultaneously fit into the observed data. Other softwares like SAS, SAAM, and BMDP are commonly used for such regression analysis. Other softwares like KinPack is actually used to obtain the area under the curve, the peak plasma concentration, which we actually call it as Cmax, and the peak plasma time to achieve that concentration, which is called Tmax. These terminologies you will definitely study in your upcoming semesters. At this very moment, you must understand that which software is actually utilized for determination of what. So other than this, there are other softwares like strip and stripipack. These programs are actually used for mathematical analysis of a poly-exponential curve by doing exponential stripping, and such programs actually help in therapeutic drug monitoring of patients, like determining the clearance, the volume of distribution of digoxins and aminoglycoside antibiotics. They are actually estimated using such programs or softwares. So the patient dosing based on estimates of such programs, what is the advantage of using such kind of softwares? The actual advantage is we are able to reduce the concentration variation in the plasma concentration, and if we compare them with fixed dose in all patients, regardless of what their renal function is, how their biliary situation is, so how that particular drug is going to show its effect in the plasma, so that we can determine in a programmed way. That's why these softwares have been developed. These are a few books that I have referred for preparing this content for you. Thank you for your patient listening.